Thank
I'm
you.
Gail Patel. I'm a physiotherapist team lead for the Cares team, Long COVID Rehab in Tayside. We're a small team. We've been up and running since about July last year. We've had just shy of 500 referrals to date. Um, we're an integrated team of OT and physio, and we can also refer into dietetics, speech and language, and the psychological services as well. What we don't have is any integrated medical input, and I think that's the thing that we're really driving for now. So very helpful, you gave me a few questions to answer to guide my 5 minute session. So the first one was, how have those suffering from long COVID responded to the service, and what has feedback been like? So we actually just did a patient feedback survey very recently, conducted by a student on placement. So it was independent of the clinicians who'd been involved in their care. And feedback was actually overwhelmingly positive. We asked 7 questions on a telephone survey, and we wanted to learn a little bit about what people felt they had gained from our service, what we could improve upon, whether individuals felt that we had taken their thoughts and feelings into account when making our treatment plan and goals, and were staff empathetic to the needs, and also whether patients found near me and telephone call was a good alternative to face because we were very limited at that time. Some of the key things that came out of that were that patients felt they were supported, reassured about some of their symptoms. They felt they were given practical support on how to cope with many of their symptoms. And a better understanding of their condition, and some confidence to deal with some of the things they were dealing with, and also just referral on to other professionals where it was needed, and signposting in the right direction. Things that we felt could be improved upon. Some key themes were it would be better if it was face to face, and we've now started to do much more face to face assessment where we can. Still very limited with that because we don't have a dedicated clinic space. And I think the other key theme that emerged was really that if the team itself could either have integrated medical input or order medical investigations in some way. And the last thing was shorter waiting times and faster access to the service. And we're acutely aware that we're trying to balance the complex needs of the patients that we are seeing, individuals we are seeing, and manage rehab effectively whilst we have a growing waiting list. And it's a really difficult challenge at the moment with such a small team. Your second question was asking about whether all patients have been referred from GPs or secondary care, or how do patients find us. So patients can self-refer into our team. We have a telephone referral line. Clinicians can refer via generic email. The majority of our referrals came through a social media drive at the beginning, with posters released on Facebook, NHS Tayside Twitter, social media pages. More recently, probably about 3/4 of referrals come via GPs, so GPs asking patients to self-refer themselves. The third question was saying that today was the first anniversary of our service, and had we been involved with other services around the country sharing our learning. So absolutely yes, we've hooked up with services in Edinburgh, the new staff service in Glasgow, Dumfries and Galloway, Lanarkshire. So yeah, we're trying to share learning, share from what we've learned already. It's been a very steep learning curve. And for us also to learn from other much bigger services down south who are more established than us. Your fourth question was, what struck you most about those who you care for and support, and what has been your biggest learning? That's a big question. I could probably talk about that for an hour. It's been a very steep learning curve. I think the main thing's been around the complexity of long COVID, the varied and changeable presentations of the illness, the relapsing, remitting nature of it, and how to help people cope with that. I think we've got a long way to go still with that, and we're learning every day and trying to keep up with the research that's coming out. I think the thing that struck me most about the patients is just the devastation this illness has caused people, and the impact that's had on people's lives, turning people's lives upside down, as we've heard very clear already. But also the determination and motivation that patients have to return to a more normal life, and the courage that patients are showing in that difficult journey they're having at the moment. So yeah, absolutely. You asked me, what do you see is needed to provide support and care for those long COVID? I think we've already covered a lot of that. It needs to be holistic, it needs to be timely, multidisciplinary, multi-agency. It needs to be coordinated. That's probably the biggest thing for me. It needs to be coordinated and have integrated medical support with clear pathways for access to all the services. Return to work support, I think, is a really key thing. We're doing a lot of that, and peer support as well. And it needs to address physical and mental health needs. You asked me whether we were finding individuals with long COVID had a diagnosis, medication support required before they reach you, not consistently. End of. And if I was made Minister of Health tomorrow, what would I do to address the care needs of long COVID? I think I would want dedicated long COVID teams in all health boards in Scotland, or if that's not an option, to have adequate investment into existing services to allow additional capacity to treat this client group effectively, and to ensure that those who are affected by illness have access to appropriate benefits if they're unable to work without going through the terrible, terrible system we've got at the moment. And I think it would also be helpful to define long COVID as a long-term condition with the same access to longer-term follow-up as other long-term conditions. So that's me. Thank you for listening.